Welcome to This Explainer. Today we're jumping right into some incredibly impactful research that just dropped in the Elsevier journal, Evaluation and Program Planning. The paper is by the Valiant Foundation and it's called Cardiovascular Screening in Homeless Outreach, an Operationally Ethical Protocol. Basically, they proved that it is entirely possible to safely conduct life-saving, ethical cardiovascular screenings right on the streets of San Francisco. It's a true game changer for public health. But before we get into the data, I want you to really think about the sheer logistics of this one question. How do you provide preventative healthcare to someone who doesn't have a permanent address? We know folks experiencing homelessness face way higher rates of cardiovascular disease, but the barriers they face just to get care, they're massive. It really all boils down to access, right? I mean, think about standard clinical care. It requires making appointments, having health insurance, a sanitary environment, reliable transportation. But the street-based reality is literally a world away. Folks living unsheltered are constantly dealing with transiency, daily survival, insane environmental stress, and often a really deep mistrust of institutions. So preventative healthcare just falls by the wayside, and chronic conditions end up spiraling into full-blown emergencies. Now, don't get me wrong, standard humanitarian outreach groups are out there doing absolutely vital work handing out food and basic supplies. But there's been a glaring gap when it comes to early physiological screenings in the field. Those big, resource-heavy mobile clinics are awesome, but they can only reach so many people. What was missing was a standardized, ethically reviewed protocol to do these health checks safely, right there on the sidewalk. And that is exactly what this project was built to fix. So the Valiant Foundation stepped up and deployed this incredibly agile, low-resource methodology. Over a 13-month period, they ran this field-based intervention straight into the heart of some of San Francisco's most resource-scarce and transient neighborhoods, specifically the Mission District, the Tenderloin, and the Abarcadero. What I love about their approach is the empathy-first design. Step one wasn't a medical check. It was just offering food, water, and essential supplies. And that was given whether the person wanted a medical screening or not. It's all about building trust. Only after that did the volunteers screen for decisional capacity, get explicit verbal consent, and then finally collect those vital signs. It's entirely built around the participants' autonomy. And a huge part of protecting that autonomy was their strict, hard stop protocol. This was an absolute rule. If at any point during the medical assessment a participant seemed to lose decisional capacity, showed any signs of distress, or simply said, you know what, I'm done, the screening stopped immediately. No questions asked. It guaranteed nobody felt pressured into giving medical data just to get a warm blanket or a sandwich. Operationally, this was a massive success. The team hit 100% fidelity in verifying decisional capacity and getting informed verbal consent across all 116 encounters. Every single participant who engaged had verified capacity. It proves that, yes, you absolutely can maintain rigorous ethical standards, even in fast-paced, unpredictable street outreach. Okay, let's talk about the findings, because they paint a picture of a silent crisis. Out of a subset of 59 valid blood pressure readings, a staggering 72.88% of participants met the criteria for stage 1 hypertension or higher. Let that sink in. That is an enormous burden of cardiovascular risk hiding in plain sight. And honestly, it gets even more alarming. Over 10% of the folks screened met the criteria for a hypertensive crisis. We're talking blood pressure readings over 180/120. These are literally life-threatening emergencies that require immediate medical intervention. And they were caught just by bringing basic FDA-clearing monitors out onto the pavement. It wasn't just blood pressure either. The screenings picked up on a bunch of other major risk factors. Nearly 37% of people showed elevated heart rates, consistent with tachycardia. They also recorded significant nicotine use and self-reported diabetes. It just goes to show how quickly field-based vitals can flag high-risk individuals before a major health event strikes. Because the volunteers were so thoroughly trained, they were able to safely activate emergency response protocols 9 different times. We're talking interventions for hypertensive crises, hypoglycemia, and even coordinating EMS transport for someone experiencing suicidal ideation. It really proves that community nonprofits can absolutely bridge the gap between handing out a pair of socks and providing acute medical triage. But here's where the ethics really come into play. When participants who were clearly having a medical emergency politely declined to have 911 called, the volunteers legally and ethically respected that choice. Often, folks were just terrified of the crushing hospital bills. The team still provided care, info, and food, but they never forced an intervention. It's a stark reminder of how deeply homelessness is intertwined with systemic issues like poverty and healthcare inequity. There's this one field narrative from the paper's appendix that I absolutely have to share. A participant simply asked to use a team member's phone to call his mother. Afterward, he told the volunteers he felt a restored sense of connection and dignity. It's such a powerful reminder that while we're focusing on data and vitals, simply treating people with basic human empathy is a profound intervention in itself. So, bringing this all together, what's the big takeaway from this explainer? It's that organizations don't have to stop at just distributing basic supplies. By integrating these ethical, evidence-based health screenings, they can identify life-threatening conditions early on. It proves that unhoused folks will absolutely engage with healthcare if they are approached ethically. And best of all, it provides a totally replicable blueprint for any group wanting to do the same. We owe a big thanks to Principal Investigator Sarah Jean Valiant and the whole Valiant Foundation team for this. By publishing this highly scalable framework in Elsevier, they've given public health organizations worldwide a transparent, peer-reviewed model. It's a tool that can literally transform ethical outreach practices and bring preventative care to some of our most underserved populations. I want to leave you with this thought to ponder. We've seen exactly how effectively this low-resource model worked on the streets of San Francisco. Imagine the sheer impact on healthcare equity if every single outreach team in your own city adopted this life-saving framework. The tools are here, the ethical guidelines are proven, and the potential is literally boundless. Thanks for joining me for this explainer, and stay curious.